Okay. Hi, everyone. Welcome. It's so nice to see you all. My name is Anne Marie Garcia, and I am the Director of Community Programs for Pelham Together. And for those of you who are not familiar with Pelham Together, I wanted to just take a moment to share our mission, and that is to support the physical, social, and mental well-being of our youth by offering as many opportunities to build resilience and a sense of connection and belonging. So, our vision is for every young person in Pelham to know they matter and feel that they belong as members of this community. Tonight's event with Dr. Martinez is part of our Parents Talk series, which is how we organize small and large group conversations with a variety of experts on a number of youth-related topics. And topics come to us from parents and caregivers like yourselves who've made suggestions on real-world situations and challenges that they are looking for information on and strategies, suggestions in an effort to support their kids. So we want to thank you for filling out our poll in the fall, because it really matters. When you fill out the surveys that we send out, it ensures that programs and resources that we provide like this really directly connect to the needs that you identify. So I think, as you saw, tonight's presentation is being recorded and will be sent out to everyone in a follow-up email, along with a very short survey, which I'm going to mention at the end. So tonight, we're very excited to have Dr. Martinez here this evening to share her talk, Using Science to Talk About Drugs. So just a bit about Dr. Martinez. Diana Martinez is a psychiatrist who studies the neuroscience of drug use. She has a research lab at Columbia University Medical Center, and she has two sons. As a mom and a researcher, Diana has found that using science to discuss drug use with teenagers can improve health and safety. I'm going to turn it over to Dr. Martinez, but at the end, we'll do a Q&A. So with that, I'll turn it over to you, Dr. Martinez.
Great, thank you. And thank you all for being here. And thank you for the introduction. And to put a little bit of perspective, I'm a psychiatrist. I went to medical school and residency in the last century, so it was a long time ago. After finishing residency, I decided to do neuroscience research in addiction and substance use disorders. And I still love the neuroscience of it. I just love. I mean, it's just this beautiful system. But then I had two sons, and I was like, wow, is this neuroscience really useful or not? Because I needed to find a good way to protect my sons when it came to substance use or drug use. And, I tried a number of different things with them, the don't do anything. If you have one cigarette, you're going to die. That worked when they were in kindergarten, but it didn't work once they got a little bit older. So as time went on, I really, thought long and hard about how can we talk to kids about drug use, especially because it's such a huge risk factor. And I've done addiction research now for 20-something years, and I certainly know that practically every substance use disorder begins in the teenage years. So I started giving these talks probably about 5 or 6 years ago when my older son, who's about to graduate from college, but when he was in high school, and really, decided we use science to talk about sex education. Can we use science to talk about drugs? And that's what I'll be talking about tonight. So I'll share my screen and flip PowerPoint. And sorry, give me 1 second. Do you all see my slides? Yes?
Not yet.
Yes.
I see your mouse.
You don't see my slides?
I don't. Does anyone? Okay, no, not yet.
Oh, no. Okay, that's not promising. Let me try again.
There we go.
Okay, perfect. Perfect. So we'll be talking about using science to talk about drugs. And I just want to point out that the work that I do is supported by the Opioid Response Network. They've done a lot of work with respect to going over my slides, vetting them, making sure that they're scientifically accurate, and they provide resources when it comes to opioid overdose. They're mostly working with substance use disorders, but we're doing more to work with high school students. So let's talk about drug use and the data. So accidents are a top cause of death among teenagers. This was the case when I was in high school a long time ago, and it remains the case now. And about half of all accidents in teenagers involve drug use, mostly alcohol, but sometimes cannabis and other drugs as well. Overdose is another significant major cause of death among young adults, mostly opioids, but there is some alcohol use involved in this as well, which I'll go over. And then when it comes to assault, especially on college campuses, about half of assaults involve intoxication. So these are the top three of these are the most immediate risks that come with intoxication. And what I'm going to be talking about tonight is how can we protect our kids and talk to them about these risks so that they're in a safer environment. And then lastly, addiction affects about 40 million people in the United States. It's actually about as common as heart disease, and it begins mostly in the teenage years. And this is a long-term risk of addiction, and this will be the second part of tonight's talk. So, those are the risks. That's the scary news in the last slide. Now let's talk about what can we do about it. Well, we can use information from the past. The first thing we know is that when it comes to drug use, we know that punishment doesn't really address the problem. I can tell you, having done this kind of research for 20-something years, punishing people for drug use has very limited effects. It has some effect, but it really doesn't stop the problem altogether. And then what I've seen with a lot of parents is just avoiding the issue altogether and hoping for the best. And I think we can do better than that as well. As I mentioned, we know how to protect against the risks of sex. We know that science-based sex education, which focuses on biology, decision-making, and safety, can be protective. It protects against unplanned pregnancy, sexually transmitted infections, and sexual assault. It even delays the initiation of sex. So the idea here is that, well, let's take what we know works for sex education, meaning science-based sex education, and see if we can do this to improve safety and decision-making when it comes to drug use. So when we're using science to discuss drug use, we're going to be talking about, again, biology, decision-making, and safety, knowing how to recognize a dangerous situation, and knowing how to help someone in trouble. And then, as I mentioned, we'll also talk about the risk factors for addiction. And, I've been giving these talks now to high school students for a few years. And I have to say, focusing on how you help a friend who's in trouble really has a significant impact. And I talk with high school students about this a lot, like how do you recognize a dangerous situation and how do you help your friend? And when I talk to teenagers, that really resonates with them. But what we need, the really important piece, is that we need adults. We need parents that can be contacted in case there's trouble. And that's one of the reasons why I'm talking to you tonight. So let's start with part one, the risks of intoxication. And I'll start with alcohol, which is the most commonly used drug. It's the most known drug. And when I talk to teenagers about alcohol, I talk about the dose because everything is about the dose. I talk about the risks of alcohol depend on the dose. So when somebody has a drink of alcohol within 1 to 2 hours, they generally feel more social, more relaxed. This is why alcohol is usually the drug that's used as most parties. But the risks of alcohol increase tremendously as the dose goes up. Somebody who has 2 to 3 drinks within an hour becomes much more impulsive. There's a loss of fear. The parts of the brain that are in charge of decision making and fear and anxiety tend to shut down. Coordination worsens, hand-eye coordination worsens tremendously, even with a low dose of alcohol. Once we get to higher levels of alcohol, 3 to 4 drinks, this is within an hour or two, people can have a blackout where they have no memory of what's happened and they make very poor decisions. And then once we get to higher levels of drinking, which is unfortunately fairly common in parties and especially in college, but even in high school, there's a risk of death, a risk of overdose by alcohol. Usually we call this alcohol poisoning, but it really is an overdose. And sometimes people just have too much to drink too quickly and the brain will shut down. It depends on how much alcohol is consumed. So one drink, in science, we break things down sort of very scientifically as to how much is 1 drink, 2 drinks, etc. This graph just shows how much alcohol is in a mixed drink versus wine versus beer. But what's important to know, especially among young people, teenagers and adolescents, is that once you start getting into these large quantities, whether it's a red Solo cup or even worse, a gallon jug, the amount of alcohol is usually unknown, especially if it's a mixed drink. It can be anything from a small amount, often to a very large amount. And, it's important for teenagers to know that there can be a lot of alcohol in a drink and how this can be very detrimental to one's health. As I said, the main risks of substance use, the main risks of drug use are accidents, assault, and overdose. And as I mentioned, accidents, are a significant risk when it comes to teenagers. But we need to make it clear to kids that we're not just talking about motor vehicle accidents. Most people know, don't drink and drive, which is a very good a good thing to live by. But accidents are not just limited to motor vehicle accidents. Accidents when it comes to alcohol can also include things like swimming. Actually, about half of all swimming, drowning deaths involve alcohol. It can include things like skateboarding. It can include things, even just walking out in the cold. It can include climbing, biking. All these different things can be quite detrimental and problematic when alcohol is involved. As I mentioned, when it comes to assault, about half of all assaults involve alcohol. This includes both sexual and physical assault. And then with respect to overdose, about 6 deaths a day in the United States can be attributed to an alcohol overdose. So when I'm talking about using science to talk to teenagers and young people about drug use, I'm talking about being sort of very clear and upfront with what the risks are and how to counteract those risks. So when I talk to teenagers, I always start with alcohol when I talk to anybody because it's the most commonly used drug. But when I talk to teenagers, I always get asked the question, well, isn't cannabis safer than alcohol? And I always use the term cannabis. It's a scientific name. Sometimes people use marijuana, pot, weed. There's many, many, many different names for cannabis, but I just stick with cannabis because that's what I'm used to using, and it keeps it sort of within the realm of science. And I always get asked the question, well, isn't cannabis safer than alcohol? And my response is, well, it depends on the situation. The answer is not all yes, nor is it all no. So when it comes to an overdose, there are no reported lethal overdoses on cannabis alone. So if we're talking about an overdose, cannabis is safer than alcohol. That said, if you combine the two, alcohol and cannabis, the risk of an overdose does go up significantly. So by itself may be safer, but not when it's combined with other drugs. And then no, when it comes to cannabis versus alcohol, cannabis is not safer when it comes to an accident or assault or overintoxication. So cannabis, just like alcohol and driving, cannabis and driving increases the risk of an accident. Cannabis and other things like swimming, hiking, biking, skiing, all these different things also increases the risk of an accident. When it comes to assault, most of the data is with alcohol. So when I'm talking about assault, I'm really talking about becoming the victim of an assault. So anybody who's used a substance or used a drug is more likely to be the victim of an assault because their level of decision-making and consciousness is not what it normally would be. And so cannabis, we're seeing more and more reports of cannabis being associated with assault based on the effect it has on consciousness and alertness. So that's when we talk about accidents and assault. Now, when it comes to cannabis, we do have an issue with overintoxication. So overintoxication with cannabis is likely not to be deadly, but it can be incredibly miserable. It's associated with anxiety, confusion, low blood pressure. Sometimes a person needs to lay down because if they stand up, they're so lightheaded that they feel like they're going to pass out. They can be very paranoid or delusional. The only treatment for cannabis overintoxication is time. Often what happens is if somebody has too much cannabis to use, everybody breaks out their phone. They look up treatments for cannabis overintoxication, which is sometimes referred to as a green out. And there's all kinds of different home remedies online. Sometimes things like eating sweets or chewing peppercorns. None of those are accurate. The important thing is to not put anything in a person's mouth if they're not feeling well, and time. And really the important thing is to get help for the person. More and more, we're seeing reports of a heart attack with cannabis use. This is with smokers specifically. We haven't seen it so much with edibles at this point, but time will tell. It's not a big risk. It's about 1.5% of cannabis smokers report having or seen in emergency departments with a heart attack. The risk is increasing as time goes on. And we were sort of keeping track of this. What's important to know is that anybody who's experiencing chest pain or chest pressure, trouble catching their breath after smoking cannabis, needs to be seen in a hospital right away. So over here, I have the data comparing oral THC to smoked THC. This is just a study that was done some number of years ago. And when I'm talking to my own children or other teenagers, I always try to point out the time course of different types of THC that's consumed, THC being the active ingredient in cannabis. So when somebody smokes THC, it has an effect. This is over here shows the intoxication or the subjective high. Smoked cannabis has a very quick time course. Usually within about 15 minutes, the person feels something. When it comes to edible or orally consumed cannabis, the time course is very slow. The peak effect isn't until about 2 or 3 hours. So what happens is when people are trying out, especially edible cannabis products, which are now available everywhere, they take one, they don't experience anything, they take two, maybe even three, and then the effect kicks in many hours later where the person can be somewhere that's very unsafe. So when talking to teenagers, I'm always very clear about this time course. And when with respect to anyone who might have taken oral cannabis can find themselves in trouble hours later, either having taken too much or being in a dangerous situation. And then, we can't talk about drug use without talking about opioids and the overdose risk. And I can't stress how important this is because opioid overdose risks just continue to rise. As I mentioned, I've been doing this work for a number of years, and I can say that, years ago, we thought that this had to be as bad as the opioid epidemic could get. And at this point, it hasn't gotten better. In fact, at this point, teenagers are now the fastest growing group to die of an overdose. And most of that is because of contaminated drugs. So over here, I'm going to show, the dose of heroin. This is a lethal dose of heroin. So this is the amount of heroin that will kill somebody who's not used to taking heroin if they take one dose. But now we have to contend with fentanyl and carfentanil. These are synthetic versions of heroin, if you will, or synthetic opioids that are being found in many different kinds of drugs. And as you can see, the lethal dose of carfentanil and fentanyl are tiny. It's a few grains of salt. As a result, this is why we're seeing so many opioid overdose deaths these days, is because of fentanyl and carfentanil. So all heroin in New York City and in New York State has fentanyl in it at this point. It's incredibly risky to even experiment with heroin because of this risk. But it's not just limited to heroin. We're seeing a lot of counterfeit pills. This is an example of a fake Percocet and a fake Vicodin that contains fentanyl instead. These are the kind of pills that have caused many hundreds of thousands of deaths, not only among young people. We can include Prince in this category. Prince died of a fake Percocet. I think Mac Miller died of a fake Percocet. Any pill that anybody takes that doesn't come from a parent or a pharmacy should be considered incredibly dangerous. And we have to get this message out because the risk is just too incredibly high. These pills are now being sold through social media, through friends, through acquaintances, and they really can be incredibly deadly for someone who's just experimenting or just trying to get an idea, just trying to figure out what they wanted, what they think that they're doing. It can be really quite dangerous. However, there is some good news, and the good news is that naloxone saves lives. So naloxone is an antidote to an opioid overdose. It will stop an overdose in its tracks as long as it's due to opioids. If you give naloxone to somebody who's overdosing on something else, for example, alcohol, it won't hurt them. But if it's opioids, it will prevent a death from happening. This is what a naloxone kit looks like. These are now available through pharmacies and through other services. If you go online and search naloxone kit, you can find out where you can get access to one of these. I keep one at home. This is an example of the kit that my older son took with him to college when he went away to college and he turned 18. I sent one with him. It includes 2 doses of naloxone here. These are intranasal. They just get sprayed into the nose. It has gloves. It has some instructions here. As you can see, I added my own instructions here. Call 911 and call mom. I was going to put call mom first, but I realized I should put call 911 first. And it is important, if anyone uses naloxone to help someone with an overdose, you have to call 911 because naloxone can stop an overdose. But if they've taken a high dose of an opioid, the naloxone can wear off and the overdose can come back. So you usually have to give both doses and call 911 is so that you can get help as soon as possible. And I do think it's just crucial for everyone to know what an overdose looks like. And I'll talk about the symptoms in a little bit. Whether you're a teenager, college student, or a parent, we have to have a better awareness of what an overdose looks like and how to stop it from happening. This is my safety slide. This is an example of my safety plan. For example, with my own kids, I think it's important for every parent, every family to have a safety plan when it comes to drug use so that we all can be on the same page. And the important thing is you want your kids to be able to contact you if they feel like they're in trouble. With my own sons, I'm like, if there's any issue that comes up with drug use, or frankly, any issue with it all, I want you to contact me. We can talk about the issues later, but in the heat of the moment, if there's trouble or even the fear of worry about trouble, we're going to solve the problem and just make sure that safety comes first. So let's start with accidents. I keep mentioning these risks over and over, but they're the same: accidents, overdose, and assault, and I'll go over them again. So as I mentioned, accidents, friends don't let friends drive drunk or under the influence of any drug. And again, it's not just drug use and driving, it's any kind of activity that involves hand-eye coordination, whether it's driving, biking, skateboarding, walking out in the cold, or swimming. Assault, a decreased level of consciousness or the ability to make decision, increases the risk of being the victim of an assault. And as I say with my own kids, this is unsafe, and friends have to watch out for friends. If you think that your friend is at risk for an assault, you reach out to me and you contact me. Over intoxication is very common. I just think it's incredibly common for most people, probably most people on this call. Many people in this country have had the experience, especially when they're young, of going to a party and having too much to use. And what happens is that the person feels embarrassed and scared, and they want to get home. And they often try to get home by themselves. And that's one of the riskiest things that can happen. You instead want to help your friends if they're in this situation, or more importantly, if you're a parent, you want your child to reach out to you, and you will help them get home and help them get home safely. Because trying to get home when you're over intoxicated and used more than you meant to, or used when you didn't know something was in there, if any sort of drug use that is unintentional or more than expected, requires help. And the first thing we need to do is provide help to our kids. As I mentioned, after the fact, we can talk about issues, but in the acute moment, we want to make sure that our children can reach us and are willing to reach us and can reach us for safety. So overdose, as I mentioned, overdose is most common with opioids and alcohol. And most opioids are not instantaneous. For the person who's experiencing an overdose, the world can go from very clear to sort of very dark quickly. But for other people in the room, there is time to help and there is time to react. When somebody doesn't feel well, or they kind of lose consciousness, or they're not really responding, there's a lot of panic. Everybody tries to figure out what drug that they took or what happened. That's not the right thing to do. The right thing to do is to focus on the person instead. Make sure that they're okay. The symptoms of an overdose include fear, confusion, dizziness, drowsiness, chest pain, nausea. I keep it simple when I talk to my own kids or other teenagers. If the person can't walk, talk, or stay awake, you have to get help. If there's any change in the level of consciousness, if they can't stand up by themselves, as I said, they can't walk, if they can't speak clearly, if they can't stay awake, you have to get help. The important thing to do is put somebody in the recovery position, which I show here, laying on their side with one leg bent over, the top leg bent over. That will keep a person on their side. It will keep them from breathing in vomit if they do feel nauseous and vomit, and it will keep them from breathing in other things. So you put the person in the recovery position and you get help. This includes calling 911, making sure first responders can find you. I suggest calling a parent as well. And as I mentioned, naloxone saves lives. So anyone who's unconscious or has impaired consciousness in any way, if you give them naloxone, it will not hurt them. If it's an opioid overdose, it will save their lives. But if it's let's say something else, let's say that they have diabetes and they suddenly have like a change in their glucose, and that's why they're not being conscious at a party. You can give them naloxone, it won't hurt them, and you can still, get them help. So as I said, with my own kids, I'm like, friends watch out for friends, parents watch out for kids, and getting help makes a difference. So the question, of course, is, what can parents do? As I mentioned, it's important to have a family emergency plan. You want to encourage your kids to contact you if there's any trouble whatsoever. You want them to call home rather than trying to solve a problem alone. And as I said with my own kids, I'm like, my policy of contacting me and getting help first extends to their friends as well. Now, I do want to point out, some other data that I've been asked previously when it comes, especially to alcohol. There's an impression that teens who are exposed to alcohol at home will somehow drink more responsibly. I guess it may be more common in European countries or some Latin American countries that if you drink at home with your parents as a teenager, you learn to drink more responsibly. However, the data really doesn't support this at all. In fact, the data shows that it doesn't improve safety and it can actually backfire where the earlier somebody's exposed to alcohol, the more dangerous it is for them. Also, allowing alcohol at high school parties by parents doesn't really provide any protection at all. I know it might feel that way, that if you have, a contained environment with alcohol, but, the data shows pretty clearly that it doesn't improve safety and it increases the risk of harm to others. It's also illegal in most states. And the same applies to other drugs as well. So even though, none of us want our kids going to various situations and social situations and using drugs, we also can't make that easier for teenagers either. So now I'm going to switch gears. I'm going to talk about mental health and drug use. So the first part of this talk was just about the acute risks of intoxication, especially among young people who are in situations where they often don't know how much is being taken and may not be in safe situations. Now I'm going to completely change gears and talk about mental health and drug use. I'm really going to be focusing on problematic drug use. So let's take a step back for a minute and talk about, like, well, why do people use drugs anyway? Not necessarily teenagers or young people, just in general. Why do people use drugs? Well, there's a lot of, short-term effects that people enjoy when they use drugs. So for example, nicotine improves cognition, attention, and it reduces stress. Talk to anyone who smokes. Some of us, I'll admit, I smoked back when I was in college. If you have a stressful situation, nicotine can make that stress go away immediately. Nicotine can make you forget about all the noise in your brain and focus on what you need to do. It actually is remarkably effective at improving cognition and attention. And I'll talk more about this in a little bit. Alcohol reduces anxiety, especially social anxiety. As I mentioned, is probably the most commonly used drugs in social situations. It can also improve depressed mood. Cannabis has anti-anxiety properties, improves sleep. It also lightens mood. Cocaine and amphetamine can increase attention, cognition, and productivity. And opioids, all of them, whether it's heroin, Oxycontin, Percocet, Dilaudid, Vicodin, more, are very potent painkillers, and this includes not only physical, but also emotional pain. So the point of this slide is that we have to think very long and hard about self-medication. Self-medication is incredibly common. And by self-medication, I mean using drugs or using a substance to address psychiatric symptoms. And let's start with nicotine. Nicotine or tobacco and e-cigarettes. When I'm talking to teenagers, I always talk a little bit about the neuroscience of it. Nicotine acts on the thalamus, which is sort of deep in the brain, and the role of the thalamus is to switch attention or direct attention to where it should go. And nicotine actually improves the efficiency of the thalamus. It helps concentration and attention by making the thalamus more effective. In fact, with research studies, we can actually show that if we have somebody with ADHD or depression and we give them a nicotine patch, we can improve their symptoms. We don't normally use a nicotine patch to treat these disorders because we have medications that work better, but it does show the power of self-medication. So this is data I have here with severity of depression, and over here I have data with ADHD. So let's start with the depression data. This is looking at the prevalence or the number of people who smoke. This is females up here and males down here. And the dark blue bar is severe depression, the light blue is moderate depression, and then green we have mild and no depression. And what this data shows is that somebody who has a greater severity of depression, a woman with a greater severity of depression, is much more likely to be smoking versus someone who doesn't have depression. In fact, it's about half of women with depression are smoking, and the data is similar with men, not exactly the same, but very similar. So what this data shows is that smoking and depression go hand in hand. This is an example of self-medication. If somebody's experiencing depressed mood, nicotine can make this lighten up. Same with smoking and ADHD. About 40% of Americans who have ADHD smoke, and part of this is self-medication because, as I mentioned, nicotine can make the symptoms of ADHD improved. The problem is it's only short term, and I'll talk more about the problems with self-medication, but I just want to put this data out there to show the power of self-medication. So let's talk a little bit about the psychiatric disorders in teenagers that are associated with drug use. And I'll start with depression, which is the most common. Depression occurs in about 20% of teenagers. The symptoms include feeling sad, hopeless, worthless. There's a loss of activities, a loss of interest in activities, school, or friends. The problem with depression is that there's a lot of trouble concentrating. People report low energy, sleep problems, insomnia, or too much sleeping. And sometimes teenagers with depression hurt themselves with cutting or scratching of the arms or legs. Next, I'll talk about anxiety disorders, which also occur in about 20% of teenagers. Anxiety disorders include persistent worry and fear, indecisiveness, trouble concentrating. A social anxiety disorder is an intense fear of social situations and a fear of being judged. This includes speaking up in class, meeting new people, using a public restroom, or eating in front of others. A generalized anxiety disorder includes persistent, sort of ongoing, free-floating fear and worry. And patients can often overthink decisions. And anxiety can also include fatigue, insomnia, headache, nausea. It's not unusual for anxiety to include a lot of physical symptoms, especially like headache and abdominal symptoms as well. And then borderline personality disorder is less common. It's about 1 to 2% of the population. Self-injury is common with borderline personality disorder, similar to depression, but it is a separate disorder. Patients with borderline personality disorder are also impulsive, engage in destructive or unstable relationships, and often swing a lot of mood swings between depression, anger, demoralization, and excitation. So this is data looking at the teenagers with depression and self-medication. So over here in the blue bars, we have teenagers who have depression, and the gray bars are those who don't have depression. And what this data shows is that those with depression are much more likely to be using cannabis, illicit drugs, and other drugs as well, including alcohol. And a similar pattern is seen with anxiety disorders and borderline personality disorder. So overall, what this data shows is that teenagers who have depression, anxiety, or borderline personality disorder are much more likely to be using drugs and much more likely to get in trouble with drugs, so much more likely to develop the drug problem over time. And what we do know is that treatment reduces this risk. So we really need to get ahead of the game if we can with teenagers. We need to do a better job of addressing anxiety, depression, and borderline personality disorders before self-medication sets in, before teenagers discover that, that they can reduce their symptoms of anxiety or depression with something like alcohol or cannabis. Additional disorders I'll be talking about tonight include ADHD, oppositional defiant disorder, and conduct disorder. I'll start with ADHD. ADHD occurs in about 8% of children. It actually gets a little bit higher into teenage years, closer to 10%. And the symptoms of ADHD include inattention, disorganization, hyperactivity, and impulsivity. The symptoms that we're often used to hearing about. But what's important about ADHD is that there can often be a lot of symptoms as well. Kids with ADHD have a really hard time getting along with teachers. They have a hard time getting along with their peers and friends. They have a really hard time, trouble making friends and fitting in, especially when it comes to the high school years. Oftentimes, kids with ADHD, in middle school years, there's a lot of guardrails. It may not have so many social problems, but once you get into high school, your friends have kind of outgrown some of the impulsivity, and kids with ADHD have a really hard time with social problems. And one can imagine how drug use can alleviate those problems. Oppositional defiant disorder occurs in 5 to 7% of children. This includes symptoms like lying, blaming others for mistakes, or vindictive behavior. It also includes impulsiveness and bad decision-making and defiance towards parents, teachers, or coaches to a point where the ability to function suffers. There's a lot of overlap between ADHD and oppositional defiant disorder. Most kids who have one will often have the other. About half of kids with ADHD will also have ODD and likewise ODD with ADHD. Conduct disorder occurs about 5 to 7% of children. This includes aggression or violence towards people or animals, theft or destruction of property, setting fires, skipping school, getting into fights, and bullying. And learning disorders is difficulty with reading, writing, math. All of these disorders put a child at an increased risk for self-medication. As you can imagine, if you're a child who's struggling with one of these disorders, where school is really difficult, certainly, drug use at school vaping in the bathroom is very common with kids who are experiencing psychiatric disorders. And now I'm going to talk about ADHD and drug use, mostly because this is what I see on a very regular basis. So as I mentioned, I do research. My research is all in human volunteers. My research is almost exclusively in adults. Most people who come into my studies are in their 30s, 40s, and 50s. I often spend a lot of time talking to them about how their drug problem first started. As I mentioned, it almost always starts in the high school years. And the number of times I hear somebody talk about it and realize that they had ADHD as teenagers is incredibly high. And this is borne out by the data. We now have data showing that about half of people with the cannabis addiction to cannabis had ADHD. So we have to do more to address ADHD in younger individuals. So ADHD is a significant risk for drug use, not only drug use, but risky use and addiction. This is data showing the likelihood of having a problem with drugs in kids with ADHD versus those without. And I'll just, a risk of 1 is the same as somebody who doesn't have ADHD. And what this data is showing you is that if you have ADHD, the likelihood of being dependent on nicotine is about 3 times that of somebody who doesn't have ADHD. It also has an increased use of using cannabis as a high school student, other illegal drug use, having a dependence or an addiction to cannabis, alcohol, and other drug use as well. So ADHD and drug use during the high school years go hand in hand, and ADHD and a future addiction go hand in hand. And we need to do more about this because we have a lot of data showing that treatment can reduce this risk. We know that treating kids with medication can prevent the development of a future substance use disorder. This is data that's been studied now for a couple of decades, and we know that we have to treat kids early and we have to treat them consistently with medication, and we can prevent the likelihood that they develop a substance use disorder down the road. We can prevent the likelihood that they come to me as future adults. We also know that treating ADHD with medication can prevent the risk of accidents and injuries. Kids with ADHD are at high risk of motor vehicle accidents and injuries. They're at a high risk of having a sexually transmitted infection or teenage pregnancy, a higher risk of depression and suicide. And we know that treating ADHD with medication can reduce this risk. It also improves their social functioning with friends, educators, and parents. So I can't stress enough the importance of addressing ADHD as early as we can, as effectively as we can, if we want to have our, teenagers not needing to see a psychiatrist like me, decades down the road. So let's talk a little bit about what does self-medication look like? What does self-medication look like? Well, often the warning signs of self-medication are drug use alone, drug use at school, triggered by stress, or increases over time. And so I just want to stress, when it comes to especially drug use at school, since I was in high school forever ago, anyone who is using drugs at school was sort of characterized as being a bad kid. And I think we need to change this. We need to consider the fact that children who are using drugs at school are more likely to be self-medicating than they are to be a bad kid. And I think we need to do more to address drug use at school, especially, vaping in the bathrooms or the parking lot. And we need to address this with a mental health evaluation, because I think the likelihood that somebody who's using drugs at school has ADHD or depression, anxiety, or some of the other disorders that I mentioned is really very high. One of the issues with self-medication is that people don't necessarily recognize it themselves. So you can't say to somebody, oh, are you self-medicating? Because they may not recognize that they're having psychiatric symptoms, and they might not put the two and two together, that, using, vaping in the bathroom or drinking alcohol at home is relieving their psychiatric symptoms. So often when we talk about self-medication, it's important to just start with the conversation about mental health, and then to talk about the drug use afterwards, rather than to leap right in to self-medication. So what's the problem with self-medication? Why can't we just use cannabis to treat anxiety or cannabis to treat depression? I can tell you with most people that we see with ADHD, everybody tells me that cannabis helps with their ADHD. And the problem is that most drug use, whether it's alcohol or cannabis or nicotine, they only have an effect while you're under the influence of the effect. So for example, alcohol can make anxiety better, but that only lasts while the intoxicating effects of alcohol are on board. Alcohol doesn't make anxiety better once the effects of alcohol have worn off. So it doesn't make anxiety better the next day, for sure. And so that's one of the main problems with self-medication, is that the effects are only help the psychiatric symptoms or mask the psychiatric symptoms while the person is intoxicated. They don't have any sort of long-term benefit. Self-medication can also make some disorders worse. So for example, alcohol over time will not make depression better. It can make depression worse. And the same applies to cannabis with some disorders. Cannabis can make certainly ADHD and anxiety worse over time. And then the biggest issue with self-medication is this, is that psychiatric symptoms don't just happen, on a Friday evening after work or when you've completed all your responsibilities. Psychiatric symptoms happen day and night. So if you're using drugs to address psychiatric symptoms day and night, you're more likely to develop a drug problem. Not only because you're using more, but because the brain gets used to having this substance on board or this drug aboard to make the psychiatric symptoms better. So psychiatric symptoms can lead, self-medication can lead to increased drug use at school, after school, at work, at times when drug use is definitely not appropriate. So this is the way, as psychiatrists, we diagnose substance use disorder. There's 11 criteria. A substance use disorder, which is sometimes referred to as addiction, but we use substance use disorder, can either be a mild, moderate, or severe disorder. When we talk about addiction, we talk about substance use disorder, we all have this idea in our heads of severe substance use disorder or severe addiction, meaning the person who really has, lost their lives to their drug use. But it's important to remember that it always begins with a mild disorder. Just like diabetes begins with a mild disorder, so does substance use disorder. So we need to do a better job of recognizing mild disorders. And I'll talk about this is our criteria that we use, but I'm going to put this in context in the next slide. Just keep in mind that a mild disorder is answering yes to any 2 or 3 of these questions. So moderate is 4 to 5, and a severe disorder is 6 or more. With these questions, you'll notice that none of these have to do with the amount of drug that's being used. It's all the context and the pattern, sort of consuming more than intended, failed efforts to control use, spending a lot of money, not meeting obligations, craving, continued use of the drug despite health problems, continued use despite negative effects on relationships, repeated use of the substance in dangerous situations, such as drunk driving, giving up activities because of the substance, tolerance where more is needed to have the same effect, or having withdrawal symptoms. When it comes to teenagers, though, I've tried to sort of adjust these questions to make it sort of fit more how we would have this conversation with teenagers. So any drug use that interferes with schoolwork, that is homework, not studying, or problems, problems with grades, any drug use that interferes with any schoolwork whatsoever should be considered a sign of problematic drug use. Any use at school or after school activities during the day is also a symptom of problematic drug use. And by problematic drug use, I mean drug use that's getting out of control. Missing or skipping school is associated with drug use. Giving up or quitting a passion, like somebody who used to love acting or dancing, has given up on these activities because of drug use. Sports, whether it's a formal team or a pickup game, sorry about that. Giving up these things, orchestra, yearbook club, debate team, school band, orchestra, after school job due to drug use, this is also a sign of a substance use disorder. Losing an opportunity, such as losing a job or getting removed from a team or a club because of drug use. This includes, being asked to leave a soccer team or the debate club or anything like this because of drug use is another warning sign. Drug use that's triggered by craving, stress, or being around other people using is a warning sign. And any drug use that increases the risk of an accident. So in the first part of this talk, I sort of talked about just the risks of acute intoxication. That kind of applies to everybody who's using a drug. But if somebody's using a drug more than once that gets them into trouble or has the risk of getting them into trouble, whether it's driving, swimming, skateboarding, all these things I mentioned, you need to consider drug use that's getting out of control. And then any use that interferes with relationships. This includes a loss of friends, issues with family members, or romantic relationships. But someone who's didn't have problems with their family before is having problems now, and there's drug use involved, should be considered as a warning sign for a substance use disorder. The risk factors for a substance use disorder, I'll go over quickly here. They're just simply, family history of if a parent has a substance use disorder, then the child is more likely to have a substance use disorder. It doesn't matter what kind. So if you have a history of alcohol use disorder in your family, your child is at a greater risk of having a substance use disorder, whether it's alcohol or cannabis or something else. The age of use is a risk factor. The earlier that anyone uses any drug, the greater the risk of an addiction developing through their lifetime. Having a psychiatric disorder, as I mentioned, self-medication is a significant risk factor for developing a substance use disorder. And the environment, a non-supportive environment is another risk factor. So I've given you a lot of information, and I realize a lot of it sounds sort of like kind of scary and grim, but the real thing is, we have an opportunity to change all of this. So what can parents do? How can we address this, and how can we do a better job of ensuring our kids better health down the road? So, I just want to point out that, teenagers are often characterized as being moody, impulsive, and difficult. And, sometimes it is a teenage years, but sometimes it's a mental health disorder. Most psychiatric disorders begin during the teenage years. Most of them have their origins in the teenage years, whether it's depression, anxiety, and the ADHD. Almost all these disorders begin early in life. So we need to do a better job of recognizing them early and helping our kids get help. We also need to recognize that, sometimes psychiatric disorders happen without an obvious cause. And I hear this a lot from teenagers. They might be in a very supportive family. They might have great parents who do everything for them, and yet they still feel horrible, or they might still feel very depressed or anxious. And they feel guilty for it and feel like they don't have a reason to not feel well. And they don't want to say anything to their parents because they feel as though they don't have there's no cause for their depression. Sometimes anxiety disorders and psychiatric disorders happen because something happened to the person, and sometimes they just happen. And so we need to sort of be mindful of this when we're discussing mental health with kids. I just want to add this, it's important to talk to our kids about future plans. In my experience, talking to teenagers, kids who don't have a plan for their future are the kids who are at the highest risk, not only for a substance use disorder, but also having a mental health issue. Hope for the future is protective when we're talking to our teenagers. And then I just want to point out, treatment for psychiatric disorders is incredibly crucial. And this is where high school counselors and social workers have a huge role to play. They're really on the front lines. They're in the schools themselves. And if we can recognize and treat psychiatric disorders before we head down the road of self-medication, certainly too far down the road of self-medication, we can really do a lot to prevent a future addiction. So, we have to talk about mental health. We can contact the social work team at school. For anxiety and depression, counseling and therapy can work. Some kids need medication, not all, but it's important to, start this process of figuring out who gets better with counseling and therapy and who needs to move on to medication. For ADHD, the data is a little different. We know, as I mentioned with the data, that medication for ADHD is protective. So kids with ADHD not only can benefit from counseling and therapy, we really need to be treating with medication. And this is data that goes back 30 years, showing that, treating ADHD not only improves risk of accidents, obesity, drug use, and suicide attempts, it also improves social functioning. The data is strongest with methylphenidate, also known as Ritalin or Adderall. However, atomoxetine or guanfacine, also known as Strattera or Intuniv, something like that, can also be helpful if these medications aren't tolerated well. I'll provide some resources for getting treatment for ADHD. And if you do have any concern about ADHD in your child, I suggest you check out Attitude Magazine, Attitude Magazine. It's online, it's free. They have a lot of really helpful information about how to manage ADHD. I find it incredibly useful, this resource. And then what can parents do about drug use? So the first thing that we can do is recognize and talk about problematic drug use. We have to do more to talk about drug use. We can't just leave it in the closet anymore and hope for the best. We learned from, the past decade, the past century, we had to learn to talk about sex education if we want to be protective. We have to do the same with drug use. We have to talk about the symptoms of problematic drug use, self-medication, We have to talk about the problems with self-medication. We have to get early intervention if we have, concerns that a teenager is having a drug problem. We have to intervene while it's still a mild disorder. Can't let things get to a moderate or severe disorder. And again, you have your social work team, and you have your team here from Pelham who can help step in and help. And this is just an incredible resource that you have at your fingertips to help with any questions you may have. And this is just my feedback slide, but I want to point out a few other things. I'm going to take questions now, and I'll stay as long as there are questions. If you don't want to ask a question tonight, or you want to reach me later, you can search for me. You go Diana Martinez, Columbia. It'll pull up my lab website. My email is there. For a crisis, call 988. School resources, you have Pelham Together, but you also have counselors and psychologists. These are the state resources that we have in New York. This is a federal resource. New York Quits is a very good resource for tobacco and e-cigarette use, the Trevor Project for LGBTQ kids. And I also just want to point out that when it comes to treatment with ADHD, most child neurology practices will treat ADHD in addition to psychiatrists. So that's another option as well. If you can't get in to see a psychiatrist, I know psychiatrists are very short supply. Some pediatricians will treat ADHD, and a lot of child neurologists will as well. So now I'll stop sharing, and I know I covered a lot of information, but I'm really happy to take any questions that may come up.
Thank you, Dr. Martinez. Yeah, if anyone wants to just put their questions in the chat or just unmute and ask, that's great. Whatever you feel most comfortable doing. I have a question, so I'll start it off. Are you seeing challenges not only in high school years, but in middle school as well?
Definitely. Definitely. One of the problems when it comes to the legalization of cannabis, I mean, the legalization of cannabis has been a long time coming. Let's just be honest. Like, it's also, it's a train out of the station. It is done. But one of the problems with it is the perception that it's safe. It's the same problem we have with alcohol, is the perception that it's safe. And so we have to sort of counteract this by, just having people know the information, and know the risks and how to protect themselves against those risks. And definitely it's getting, younger and younger.
Mm-hmm.
So, certainly perhaps not 6th or 7th grade, but by 8th grade for sure.
Yeah.
Mm-hmm.
And actually I have another question, or maybe a comment. Sometimes what you talked about, adults feeling sometimes they'd rather their child use alcohol or do something at home under their roof versus elsewhere. Any, thoughts around what happens when your child goes to their friends' homes and, you don't have much control there because they're possibly in a home where the parents feel differently than you do around serving alcohol in the home. I don't know if you have, any thoughts or suggestions around that.
So, as I said, as I mentioned, there's a perception that somehow kids learn how to drink at home with parents, that they learn how to drink responsibly. But the data has shown that that's not the case, that it really isn't protective in any way. What is protective is, the more you can delay drug use, the better. That's just what the data shows. But we can't really control what our kids do all the time, right? Like, I mean, believe me, with my own teenage sons, I'd love to keep them at home or sort of lock them in a bubble until their brains are fully developed, but that's not going to happen.
Right.
So, what I'm trying to do instead is sort of have a conversation with teenagers about this is what danger looks like, because I think most teenagers don't know, right? They don't know what a risky situation looks like. And so we have to do a better job of having them know what a risky situation looks like, and also have them feel comfortable contacting a parent to help with any kind of dangerous situation. The risks now are just too high.
Yeah.
They're just too high. We can't let kids, experiment with something that they purchased online and be fearful of contacting a parent if things aren't going right. We have to do more to step in and make sure that safety is a priority.
Yeah.
I have a question, if
Sure.
Okay. Gotcha. And I apologize, my camera's not on because I'm in a dark car. Um,
No
I
problem.
just wanted to know, specific to children um, with ADHD diagnosis when they're young, um, how do you recommend a parent talk to them when they're young, fifth, I'm talking about like fifth, sixth grade,
Mhm.
in what their diagnosis means, without making them feel uh, um, ostracized or different than their peers, and especially with the issue of medication, because when you start to have discussions, with your kids, I try to be very open with my children about drugs, and so when I point out, medications for ADHD, that becomes very confusing because then they say, well, you told me not to do drugs, but now you're telling me to do a drug. And I guess what I'm looking for is more, how do you suggest a parent of that age approach talking to their child about an ADHD diagnosis and the potential for medication?
So one of the hardest things about ADHD is that the person themselves usually doesn't see it, right? So if somebody has depression, the person feels depression. When you have ADHD, you don't feel like you have ADHD. You feel like the problem is with everything else in the world, not you, right? So that's one of the big challenges with ADHD is that the person themselves doesn't really see it. So you do have to have like a lot of feedback, to your child, just sort of like, what do the symptoms look like? Because it's hard to see yourself. Certainly when it comes to treating ADHD, the effects are when it comes to medication ADHD, the effects are usually pretty fast, and there's a pretty immediate effect, usually within the range of like days to weeks. And then I recommend just sort of really reinforcing, like, now you're getting along better with your teachers, you're getting along better with your friends, and sort of providing a lot of external advice, a lot of, mirroring back of what's happening in their lives with them, and sort of pointing out the advantages, because usually the parent can see it, but the person with ADHD doesn't see it themselves. When
Mhm.
it comes to the stigma of taking medications, I feel like that's kind of going away for a large extent with kids. That kids are feeling more and more comfortable discussing with being neurodivergent or having different disorders. And so kids take medication. Some are taking medication for diabetes, or they might be taking medication for asthma. So I just use it sort of along those same lines too. Like, you don't want your asthma to get out of control, land you in an emergency department. You don't want your ADHD to get out of control and get you into trouble as well. So I use other medical examples and use them equivalently with ADHD, because in my mind they are, right. Whether you
Mhm.
have asthma, ADHD, or diabetes, you have to use medical help to control these disorders.
Thank you. That's very helpful.
We do have a question in the chat, and it says, for youth with ADD, is there data showing increased likelihood in engaging in addictive behavior, or a greater chance of moving from exploring drugs to full addiction?
Yep. So kids with ADHD are at a higher risk of using drugs as teenagers and at a higher risk of developing an addiction down the road. And this is what I see constantly in my studies. I see people who had ADHD as teenagers, started using drugs as self-medication, and then developed addiction, and then they come to see me, usually a decade later than they should have come to see me. And so we really have to do more about this, because the risk of drug use with ADHD is just so incredibly high. Yet we also know that treating the disorder can be so incredibly protective. So to
I
some
just
extent,
want to,
go
sorry,
ahead.
go ahead.
I mean, to some
I
extent, I
also,
feel like a little bit of a time traveler, where I'm trying to like go back in time and stop people who need to see me down the road. Because, we can do a lot more with prevention with ADHD and do something more about a developing substance use disorder.
I want to confirm that we're using ADD and ADHD interchangeably. Okay.
Yeah. Yeah. Sorry about that. I'm using them interchangeably. Yes. Mhm.
Other questions? Okay. If there aren't any other questions, Dr. Martinez, I know you put in your slides a way to contact you. I know sometimes that might be easier for people. They might think of a question later on. So thank you for that. And yes, the presentation will be sent out. I'm going to put a link here in the chat. We always, oh, I don't know if that link is going to work properly. Let me know. Like to have you take a survey and just let us know, what you like to see in future presentations, and your thoughts about tonight. And once the video is uploaded, we'll get that to people over the next 24 hours or so. And Dr. Martinez, we really thank you for being here. I really appreciate your time and all the information you've shared.
Absolutely good to be here. Thanks.
Thanks,
Anne-Marie,
everyone.